celebratory event. We'll go ahead and congratulations on the celebratory event. We'll go ahead and go to the next slide, please, Shannon. We are here to recognize the Spring 2022 cycle awardees of the Kathelen and Dan Amos Medical Student Loan Forgiveness Program to improve access to primary care in Georgia. We are excited to spend some time with you tonight. Next slide, please. We certainly want to thank our very thoughtful and forward-thinking donors, Kathleen and Dan Amos. They are a great source of inspiration across so many different venues, and the Emory School of Medicine is grateful for their vision and generosity in making a really transformative gift to the Emory School of Medicine to benefit our students and trainees. So thank you. Next slide. The mission of the Amos program is threefold: to mitigate the effects of medical student debt on career choice, meaning that there are many people who have a great idea about what they'd like to do in coming to medical school and may find themselves stuck with the realities of financing educational debt, both debt that they had due to educational expenses before medical school and then during medical school as well. And so really want to applaud this first aspect of the mission to mitigate the effect of medical student debt on career choice so people can decide what they want to do based upon their passion and their personal mission. Second, we want to create a supportive and nurturing environment for individuals who are studying, training, and practicing primary care. So in addition to the handing out of money that comes from the donors to put against medical student debt, we also want to create coaches and advisors and mentors and a community around people who are very excited about primary care. Because I know that during parts of my medical school and my residency, I told people what I wanted to do. And they're like, are you really sure you want to do that? And I was like, yeah, I want to do that. And it was hard to find those people who supported me in a career choice for me in geriatrics and who were willing to reinforce that rather than to challenge it or to tell me that really I should do something else instead. And finally, that third part of the mission is to provide Georgia with more primary care providers. Next slide, please. Shannon, I will not steal your slides this time like I did last time, so I'm being very careful. So program eligibility, just to remind guests and family members and folks who are encouraging and supporting you in your mission to become primary care providers and physicians. This is for folks who are current students, past graduates of the School of Medicine. If you're a current student or you graduated within the last 8 years, you're eligible. And also because of the specific and special crisis in caring for Georgia's elderly, we also extend eligibility to folks who have entered the Emory family through their choice of fellowship training in Emory Geriatrics. So we are supporting folks in primary care and internal medicine, family medicine, pediatrics, and geriatrics, even though we hate to say goodbye to folks who are in our medical school program, but then decide to go to residency somewhere else or even out of the state. They are still eligible even during the period of their residency or training outside of Emory. And so the invitation and requirement is just to come back and be a practitioner in Georgia. So there's a pledge to practice that comes along with this. You practice primary care in Georgia of at least a 0.5 full-time equivalent, and it has to be in an ambulatory setting recognized by HRSA as being primary care in a primary care setting recognized by HRSA. And then for your service agreement is for 2 years for a single award. And the other good news for people who are recipients of this award this cycle is that you're eligible again next year. And so that's as soon as the fall 2022 cycle. And so if you were to receive 2 awards, you would pledge practice of 3 years, all the way up to 4 awards, you would pledge practice of 5 years. So we hope not only that we have the opportunity to provide you with some funds to go against your educational indebtedness and your educational cost, but also we hope to see you again in further cycles. Next slide. These are some data from the Georgia Board of Healthcare Workforce. The Georgia Board is very supportive of educational processes here at Emory, and they also do an exit survey of all medical students, either allopathic or osteopathic programs, and they ask people as they're exiting about the level of debt. And so there's a lot of folks who have a substantial amount of debt And so this loan program is to mitigate some of that effect to allow people to continue to choose primary care. And this next slide is my final slide, and then I will pass it over to Shannon. So not only is there a cost of the educational process as a tuition paying student at Emory School of Medicine, but by remaining a generalist and being in a primary care practice, you're actually foregoing some funding, some extra funding that you could gain for going into procedural specialties. And so we hope to mitigate by reducing student debt the need for folks who don't really want to do some of these specialties, but the funding just is very enticing. So another way that we're very proud of this program and the opportunity to create a community around primary care and to help people with their student indebtedness. And Shannon, I forgot to introduce myself at the beginning. Ted Johnson, Chair of Family and Preventive Medicine, along with my colleague Lasha Turner. We are the executive co-sponsors of the Emory Primary Care Consortium. We're really proud to help with this Amos gift and to administer it and to create the community of primary care. And so Shannon, back to you, and I'll let you introduce yourself.
Hello, my name is Shannon Thomas. I am the program coordinator for this program. And so I want to talk a little bit about the selection criteria that interview committee members and selection committee members use to evaluate all applicants and determine the appropriate recipients for this award. So the following criteria would be interest and commitment in primary care, demonstrated indebtedness or financial need, attention to producing a diverse workforce and inclusion of individuals who are underrepresented, geographic diversity, employment is has a mission of service, explicit or stated, and then representation of pediatrics, internal medicine, family medicine, and geriatrics. The application process itself started with an eligibility and statement of interest form. All applicants completed this to determine whether they had the appropriate Emory affiliation, if they intend to or are currently in a residency program or have already completed a residency program that would meet the conditions. And then to confirm their understanding of what it means to pledge to practice after, like as a condition of the award. From there, eligible candidates receive an email with a link to the full application. They complete about 20 questions. They go pretty in depth. They include personal statement. And then about a week or two after the deadline for that application, they are all invited to interviews one-on-one with healthcare providers who are Emory affiliated. They speak one-on-one with 3 separate individuals. Those individuals kind of debrief and evaluate, and then all of this information is then passed on to a selection committee. They make the final decisions about who the award recipients will be, and then they make a recommendation to Dean Ely for the final decision. So the program awardees, this cycle, we are making 9 awards of $40,000. The recipients are pledging 2 years of primary care practice in Georgia whenever they complete residency or other related training programs. And then recipients can apply for additional support. This is something that Dr. Johnson mentioned as well. They can apply for up to $160,000 total, and then will increase the service that they pledge with each award. All right, on to the awardees.
So before we get to the awardees, let's stop Slideshare for just a moment. And so one of the things that we promised you was a community, and that community started when you first applied. And it's also, there's a lot of folks on this call today, and I know we grabbed everybody during spring break for kids, and so we recognize that not everybody could be here. But I'm going to just call folks out and encourage them to just say a couple of words about themselves. If you're an awardee, we're going to pay special attention to you in just a second. So let's just go around the room and give folks a chance to introduce themselves. And Lasha Turner, I mentioned you earlier, but here's your chance to just introduce yourself to the group.
Yeah, good evening, everyone. So I'm Lasha Turner. I'm the Vice President for Primary Care and Emory Specialty Associates. And I've been with Emory Healthcare for about 9 years now. And I just want to say I'm extremely excited to be able to do this for a second cycle. The first one was extremely exciting. This is even more exciting. So just glad to be a part of this, and just want to give some early kudos and congratulations to all of you all for receiving the award.
Thanks so much, Lasha. Hey, Carter Ross, would you care to introduce yourself and just say hello to the group?
Yeah, hey everyone, my name is Carter Ross. I am the Associate Director of Finance and Strategic Operations in the Office of Medical Education and Student Affairs. I'm also responsible for financial aid. So I mean, I think it's great for everyone who's choosing to go into primary care. We know there are shortages, and definitely shortages in non-metropolitan areas. So I'm just excited to see all of you, and happy that we can help you along the way as you move forward in your medical school career and move into primary care.
Thanks, Carter. Really appreciate you. Ryan Smith, the past recipient, thanks so much for showing up tonight. Could you introduce yourself, please?
Hey everyone, I'm Ryan Smith. As Ted said, I was fortunate enough to be one of the recipients in the fall. So I was thrilled as an Emory Med School grad and an early career primary care doctor here in Georgia. I currently am faculty with our residency program at Emory in family medicine, help lead our undergraduate medical education in the department, and then a new assistant director for the primary care clerkship for our third year medical students.
Thank you, Ryan, and thanks for coming tonight. Really appreciate your help in recruiting people, and that's a turnaround ask that we're going to do of all of you as recipients as well. Ryan has been one of those people picking up the phone and talking to folks and encouraging folks to apply, and so we're really glad to see some of those folks being recipients tonight. So thanks, Ryan. Dr. Anna Merck.
Hi, good evening, and congratulations to all the current and former recipients. I'm the fellowship director for the Geriatric Medicine Fellowship at Emory, and very excited that geriatrics is included in this program to increase primary care and geriatrics in Georgia. It's much needed. So very, very proud of all of you and grateful for this program.
Thanks so much, Anna. And I'm going to call on you a little bit later, because when we go slide by slide and show a little bit from the personal statements from the students, residents, and fellows, and those currently in practice, we're going to do a round robin so everybody gets a chance to introduce a couple of folks. And so I've got two people picked out for you, Dr. Merck, and you might have been able to guess who it is. Marilyn Bond.
Hello, everybody. Congratulations to our awardees. I'm Marilyn Bond, Associate Dean for Medical Education. I work in all the areas of education in the School of Medicine with Dr. Bill Ely, who's unable to be here tonight. So I'm representing him as well. I see some familiar faces who are awardees. So I'm so happy to see some of our students who are getting this award, and past students as well. So I've worked many years representing Emory with the Georgia Board for Physician Workforce. Now it's called Georgia Board for Healthcare Workforce, and have seen the challenges of trying to help and increase the number of primary care workers in the area. So this is such a blessing, and that we're thankful that we were able to pull together, and we appreciate the Amos family for making this happen. And Vicki Rydell, who was one of the driving forces in pulling it all together for us. So I just want to thank everybody who's been able to do that, because it's been so long that we've been working at trying to reduce the debt for our primary care workers. So congratulations again to everyone. I'm happy to be here.
Thanks, Marilyn. Really appreciate your being here too. Dr. Lee Partington.
Hi, everybody. I'm Lee Partington, and I am Communications Manager for the Department of Family and Preventive Medicine and the Primary Care Consortium. So the way that I support you is by maintaining the website, providing publicity for both the application cycle and the events that we will start planning for all of you coming up. And I'm so happy to be here supporting you. Congratulations, everybody.
Thanks, Lee. Really appreciate you. You are our PhD in English literature, so we're always glad to have you on our team here. Appreciate that. And then Dave Roberts, Dr. Dave Roberts.
Sorry, I thought I could lurk and not get called upon.
Nope.
I'm Dave Roberts, general internal medicine, have the CV clinic, but been here a long time, worked very closely with Vicki Riedel, and also have had the privilege of taking care of Mr. Amos. And so I know that this is extremely important to him and especially to his wife. So this is a pet project, and all I can say is the recipients are very, very prized in their eyes. So thank you very much for stepping up.
Thanks, Dave. Appreciate you joining us from vacation. And if you need to sneak back to your family so they don't get too upset, just let us know. Vicki Riedel. And you're on mute.
I'm sorry.
No worries.
I'm Vicki Riedel, and I'm so thrilled to be on this call and have the opportunity to congratulate this group of Amos awardees. I've been at Emory for almost 18 years, and I'm an assistant vice president in the Office of Principal Gifts, and have the pleasure and privilege of working with Kathleen and Dan Amos. And as Dave and Ted have said, this is a very important special project to them, and really Kathleen Amos's dream to see this come to fruition. There was a lot of planning behind this and really unbelievable operational, thoughtful efforts to roll it out. And it's such a pleasure for me to know and work with this team. Kathleen and Dan have a huge commitment to the state of Georgia, and fortunately also to Emory. And they're very, very excited about this grant, and really hope for at least one opportunity to meet each of you. So I'm working with Shannon to see when we might make that happen. But congratulations to all of you.
Thanks so much, Vicki. Really appreciate that. And and I know we have some folks also cheering you on. I'm just going to give John Pascal just a chance to say hello. He's a fan who's here to support one of you, several of you, all of you.
Thank you. I really didn't want to speak, but Miss Esther is just such a wonderful young woman, and just want to represent her mother who is at work, and just to say congratulations to her.
Thanks so much. Thanks for joining us. Richard Jarvis.
Wow, amazing. Sorry, see, I wasn't ready to talk.
That's okay. That's okay. Don't worry about it.
I'm here as a friend of actually a lot of you. Esther, Katie, Tim, Emily. I've met all of you. I'm sorry about the others who I don't know here, but this is awesome. Congrats to you guys. It sounds like something that you've been working hard for. So happy to be here. Thank you.
Hey, thanks so much. We really appreciate you coming off of mute and just saying hello. And we're so glad that folks have invited others to help support their colleagues, and it just creates that community. All right, Shannon, go ahead and go back to the slide deck again. And if you thought you're all done sharing, I'm going to call on a couple of you to read out the awardee and the statement. And I'm going to start out with, let's see, I'm going to start out with Lasha Turner to read the first two, please. And feel free to clap and make noise after Lasha's done reading.
Awesome. All right. So I am going to read the information on Tiffany. So Tiffany Mangle. So she is School of Medicine 2014 in pediatrics. So I have realized over the past few years that no matter where I practice, my role and its rewards remain the same. While rural Alabamian parents may talk and act differently than those of Falls Church, Virginia, at their core, they are bound by love and concern for the wellness of their children. I am and want to be their first call when they need advice on their clinic or on their child's physical or mental health. So Tiffany, awesome. We just want to say congratulations to you and your award, and look forward to all of the wonderful things that you're going to do in primary care.
Woo!
So excited to have Tiffany as a recipient. Her pediatric practice is in Columbus, Georgia. And so she's a grad who previously practiced in the state of Virginia and then came back to Georgia. And that's the kind of movement that we want to encourage. Lasha, and the next person, please.
All right. Our next awardee is William McDonald. So Emory School of Medicine 2018 for geriatrics and internal medicine. So his statement reads, once I have completed my training in geriatrics at Cornell, I want to fill Georgia convention halls with providers from all backgrounds to discuss wide-ranging topics that include polypharmacy and fall prevention, my research in advanced care planning, and the importance of home visits, all while maintaining a vibrant practice with deep roots in the Atlanta community focused on the underserved. So William, congratulations on your award. And again, we are so extremely excited and happy for you. So we look forward to all of the work that you're going to do in geriatrics and internal medicine as well.
Thank you, Lasha. And congratulations to you, William. We're so excited that you're going to be coming back to Georgia. That's a really great thing for the state. William, anything that you wanted to say?
No, I just thank you so much. This is a great night, to build community, like you said. I'm so happy to be here to meet some new faces. And hopefully when I do come down to Georgia, which will be in the next year or so, I'll be able to meet everyone in person. So thanks so much for having me.
You have a shout out from your fellow Yalie, Emily Pinto-Taylor. And so
that's
you'll
right.
You'll see that in the chat box.
The network is already starting. I love it.
That's great. That's great. All right. Well, thanks so much. I'm going to call on Dave Roberts. Dave, can you see the screen well enough to read? And you're on mute.
Yep, sorry. I was also dealing with a puppy that wants to come in, my 14-year-old puppy, so forgive me.
That's okay. We've got cats already on the call.
Oh, okay, great. Well, this one I'll have to just deal with her. Anyway, to continue, congratulations, Christina Rudolph, Emory School of Medicine 2021 Internal Medicine. Congratulations, Christina. And your story, to me, being an internist means that I'll have the opportunity to work together with my patients for years on end in the office and to help them understand their health and feel confident participating in healthcare decisions. Excellent. That's a great attitude and great approach. And this is my 33rd year practicing, and I do that every year. So thank you very much.
Thanks so much. And Dave, the next awardee, please.
And congratulations to Tim. I didn't say your name right when I talked to you before, Tim. I'm sorry. Niagasaba? Never mind.
That's it.
Awesome. Thanks. I got some practice in. That was all. Congratulations, Tim. So your story and your Emory School of Medicine 2023 internal medicine, populations that are discriminated against in a social context remain understudied, underfunded, and underserved in medicine. This is a story that I have come to know far too well. It has become the heartbeat of my intellectual life, whether that be through my research interest in racial disparities or my future career goal of working to advance preventative cancer medicine. Congratulations, very exciting goals, and thank you for being on the team.
Tim, a chance to say a couple of words?
Yes, just really, really excited to be here. I'm really grateful to be accepted into this program and just to get to meet everyone as well. I think it's going to be a really good place to connect with people. So.
Thanks so much, Tim. Appreciate you and congratulations. And I am going to ask Ryan Smith to do the next two, please.
All right. So our next awardee is Katherine Robinson Sharma, Emory School of Medicine 2023 in Internal Medicine. Human connection and developing long-term relationships is what I find most appealing about a future career in primary care. I have the privilege to see patients through their illness and also their wellness, to hear about their children and grandchildren and vacations, and I get the surge of oxytocin that follows. Congratulations, Katherine. Excited to have you join primary care here in Georgia.
And Katie, would you like to say a couple of words?
Yeah, thank you so much. I'm very honored to receive this award and to be included with this group of people and to get to know all of you better. special shout out to Tim, who's my classmate and my brother through all of our third year that we just completed, and excited to be on this journey with him as well.
Awesome. Thanks so much, Katie. And one more for you, Ryan.
All right, and Emily Yang, Emory School of Medicine, class of 2024 in family medicine. In happiness or heartache, for the chance to connect it all, I'm the one who is thankful. No matter how patients may present themselves, my hope is to reach them wherever they may be, to be a moment of normalcy in monotonous and often heavy clinical visits. For patients to be seen, heard, and valued as people first, this has and always will be a core goal of mine. And Emily has done an awesome job bringing other people into primary care too, as one of our family medicine interest group co-presidents. So congratulations, Emily, well deserved.
Thank you all so much for everything. I mean, I think the primary care group at Emory should win friendliest and nicest, most welcoming group at Emory. I'm so thankful for this chance and really excited to continue getting to know all of you.
Thanks so much, Emily. We really appreciate you. I did say during the interview day that it was creating community, even in the midst of a high pressure, high stakes interview. So thanks, we really welcome you and embrace you. And let's see, and Vicky, could you read the next one, please?
Sure. Congratulations to Esther Oyurinde. Is that correct? Esther is an Emory Medicine student graduating 2025 in internal medicine and psychiatry. It says many people diagnosed with mental illness receive substandard care, and some take mental health medications that cause other medical issues. My goal is to care for these patients as I work with them to improve their mental conditions while providing care for their physical health. This will allow me to make a substantial impact on improving the quality of life of a marginalized population with mental health conditions. Congratulations, Esther.
Congrats, Esther. Would you like to say a few words?
Thank you all so much. I'm very grateful to the Amos family and to this wonderful community. I'm really grateful to my loved ones, my family, my friends. I couldn't be here without all of your support. And so I'm very happy to be here and excited for what's to come.
Thanks, Esther, and thanks for bringing fans as well. We really appreciate you. And so I'm going to have Dr. Anna Merck read out the final two recipients for this cycle.
Sure, I'm delighted. So Dr. Emily Pinto-Taylor, Emory Geriatrics Fellowship graduate from 2021. She has many specialties: internal medicine, also pediatrics, geriatrics, and now hospice and palliative medicine. So Emily's statement: I am rejuvenated by long-term relationship building, by walking with patients through the complexity of living with chronic illness, and by being the clinician they trust at the end of their life to serve as a listener, holding space for them to think about what's most important. To have had even a small role in getting a father to his daughter's quinceañera, a 6-year-old to her kindergarten graduation, a grandmother to watch her granddaughter's first communion via FaceTime. A big congratulations to Emily.
Congrats, congrats. Emily, would you like to say some words?
I feel like we're basically all saying the same thing, and all of y'all have said everything. I feel I'm really truly like blown away to have been included in this group of people, and incredibly excited. I guess all of y'all who have been doing this for a long time probably feel this way, but every time I hear a med student talk about all of the big passions that they have and the things that they want to do in the world, I'm like, man, like the next generation who's 5 years younger than me is brilliant. So I'm really excited to be in this community with y'all. Thank you.
Thank you, thank you. And Anna Merck, one more.
And I'm delighted to introduce to you all Dr. Musamal Chaudry. He's a current Emory Geriatrics Fellow. He's also a family medicine physician. And his statement, being a primary care physician, it would be privileged to be the first point of care for my patients and coordinate care based on the patient-centered model. I embrace the role this field takes in providing continuity of care and patient education regarding preventive medicine. A very big congratulations to Dr. Chaudry.
Thank you so much for this award. I really appreciate that. And that would be a great financial help, actually. One less thing to worry about, right? So, hope to see you guys, all of you guys, for the next cycle and as well as for the following cycle. Thank you again.
Thanks so much, Musamal. And congratulations to everybody. We're so excited about that. I know that several of you have actually made career choices, location choices about coming back to Georgia and being in primary care in Georgia. And so that's the intent of the donor, to facilitate that. So we just have the awardees broken down by their medical school class year. And you'll see these names going up on the website, including all the abbreviations that the Emory Alumni Office uses for each period of your training, whether that's college or med school or residency or fellowship, and on and on and on, and MPH and the like. And so kudos to these recipients. I wanted to maybe have Shannon just take down the slides for one more second, because we just got a couple of folks that came into the room, wanted to give them a chance to just say hello and a congratulations. Luke Anderson, could you just say hello and give you a chance to say hi to the group?
Yeah, hello everybody. Sorry I'm a little late. We lost power out here in Madison with the storms coming through just now, so I apologize, my router went out. But again, congratulations to you all on this achievement, and again, I couldn't be happier for you. And again, you're a part of our family within primary care in a way. So again, kudos to you and congratulations.
Thanks, Luke. Really appreciate you. Dr. Sarah DuPont, a past recipient, thanks so much for joining to celebrate with this round of participants. Do you have anything that you'd like to offer to the group?
I just want to say hi, y'all, again. Sorry about joining late. I had a friend with an emergency who was helping out. But in any case, congratulations. I'm really excited to see this kind of growing network of Emory primary care docs, and excited to be your colleagues and to stay connected and watch this group keep growing.
Here. Thanks so much. And we'll go back to the slides. We've got two more before we finish. And so a special request for you, Shannon, could you show these slides backwards? Could you show the cycle slide? So advance 2, please. Perfect, thanks. So just wanted to let you know that as a recipient, if you have continued eligibility, which I'll show you in the next slide, which is probably why Shannon put them in the other order. I just wanted to let you know when the upcoming cycles are. And it's a little bit earlier than we did at this first cycle. And so I don't want you to put the last year's date on your calendar. I want you to look at these new dates. And so we'd love to see you again applying for this award, because you could receive up to 4 different cycles, 4 different years worth of awards. You couldn't apply to 2 cycles in the same year, but you could apply in either the fall 2022 cycle or the spring 2023 cycle. That includes Ryan and Sarah, who are joining the group to support you all. And if you go back one slide and tell a friend, we really want you to reach out to folks who are either in practice or are in their residency training, or are medical students as well. We're going to reach out to folks via the admissions committee, society, small group advisors, class meetings, medical student interest groups. Reach out to Emory residency program directors. We go through the match list. Shannon will track you down and make you apply to this program. Emory GME outreach, targeted outreach. She is a sleuth. She will look up your NPI number and figure out whether or not you're eligible for this program and ask you to apply. And so for folks who are out there who are Emory alums, we do an email blast through the School of Medicine Alumni Office. We mail people postcards, we email them. And so we want you to be part of this community. We want you to help us find other people to be part of this community, to help and find additional applicants. We have the opportunity to grow this program bigger, and we hope that you'll be a part of that. And if you can go to slide 24 for us. Perfect. So I just wanted to say congratulations one last time. And Marilyn, I give you the chance to close on behalf of you and Dean Ely.
Oh, let's see. Okay, can you hear me? I think I'm off.
Yep,
mute now.
perfect.
Yeah. Well, I just want to congratulate our Spring 22 awardees on behalf of Dr. Ely. He unfortunately could not be here, but he is well vested in this program and continues to be a strong supporter. And we're just looking forward to seeing everyone at each cycle, and hope you'll continue to be as passionate as you've spoken about this evening. We're just excited that you have joined the community. So congratulations again.
Thanks so much, Marilyn. Appreciate you. And Shannon will be in touch. Shannon has been working with folks like Carter and other folks in the financial aid office to figure out how to get you this money. If you are already graduated from Emory School of Medicine and you work for Emory, you would get this in your paycheck. If you don't work for Emory and are not any longer a medical student, you actually get this check mailed to you. And then if you're a medical student, we work directly with the financial aid office to put this money against your total cost of tuition and attendance, and work out with you in the financial aid office how to make this reduce your amount of student indebtedness. Shannon, any last words from you?
Nope. I think that's everything. Excellent
Thanks,
work.
Shannon. Thanks, Shannon. To you, Lasha, executive co-sponsor of the Primary Care Consortium. Any final words from you?
Yeah, I just want to say congratulations again, being in primary care. This is so exciting. And so looking forward to getting the opportunity to network with each and every one of you. And just, again, congratulations.
All right. Thanks so much, everybody. Have a great night. Congratulations one last time.
Thank you.